Why is the Modi government fighting narrative wars instead of battling the virus that has devastated millions of lives? Unfortunately, for India, a government focused entirely around narrative management could lose its grip on reality. What else explains Union Health Minister Harshvardhan's tweet that claims reports of inequities in the distribution of COVID-19 vaccine as completely baseless? The government's own data shows that urban Indians are getting COVID-19 shots much faster than rural Indians. In 114 of India's least developed districts, home to about 17.6 crore people, only a meager 2.3 crore doses in total have been administered. To put this in perspective, that is the same number of doses administered across only 9 major cities in the country. What further reflects and accentuates the problem of vaccine inequity is the fact that just 9 corporate hospital groups in big cities have bought 50% or 60,57,000 doses of the total 1.20 crore doses meant for the private sector. The balance 50% of the vaccine doses were also procured by 300 odd hospitals in urban India, with hardly any doses left for rural India. Dear Health Minister, is this not inequity in distribution of COVID-19 vaccines? The inequities in distribution were further visible due to the Modi government reliance on only digital portals to distribute vaccines. Only 50% of rural India have an internet connection. Only 4% of the country's rural households have computers. Language barriers and complicated interfaces further added to inequities in the distribution. The Modi government's new vaccine policy also allows the centre to wash its hands of all responsibility. They may claim they have done what states have asked for, but the fact is, all they've done is pass the buck. The centre's policy of free vaccines for those aged 45 and above and paid doses for the 18 to 44 group is just arbitrary and irrational, putting more pressure on the state government. This also means that poorer states are left more vulnerable to the virus. Another example of inequity in the distribution of COVID-19 vaccines. The problem with the Modi government is that instead of addressing the problem, they address the narrative. And this is the main reason why Modi government failed to spot and contain the brutal COVID-19 second wave and push our nation into the current vaccine mess.